The dengue cases in the national capital are on the rise, and out there to inspect what is really the situation on ground, it is the Health Minister of the national capital, Saurabh Bhardwaj. Sir, thank you for joining with us. What is really the ground situation right now? Is actually the dengue cases on the rise?
Because it has rained a lot in the northern India, especially Delhi. We saw rains in April, May, June, July. Usually it doesn't rain so much in Delhi. So we are expecting rise in number of cases with respect to the vector-borne diseases. And the trends indicate that dengue cases will rise in the northern India. And that's why the hospitals have been asked to set a standard protocol like we had for corona, that if there is a suspected patient coming in, there should be a set protocol which should be basically followed religiously. Today we are holding the meeting of all Delhi government and NCD hospitals at Secretariat at 3 p.m. today, where we will pass on these instructions. This surprise check was just to get an idea what should be the protocol and how are we currently managing these patients. There are some lessons learned and there are few things which need to be improved, which we'll discuss in today's meeting.
There are guidelines and advisories also that has been released by Delhi government, and the cases, there are reports that suggest that cases have been highest since 2018. So now that you have the Delhi authorities have swung into action, what are all the actions that will be taken?
Look, I think the most critical part is the school kids. We have given instructions to government, MCD and private schools that they should ask their students to wear full sleeve shirts, full trousers, keep themselves covered, but I could see still schools are not following it. So probably tomorrow I'll go on a surprise visit with the concerned DMs, and if schools are found violating, we will take action against them.
So that was the Delhi Health Minister speaking to us, talking about what is really the ground situation and what all precautions and measures are being taken at the moment. He was on a surprise visit at the LNJP hospital. In Delhi, the cases in dengue are in fact rising since 2018. This is in fact the highest recorded cases that has in fact been reported at the moment. From since July this year, we are seeing that almost 300 cases of dengue has been reported. In last week itself, there has been 56 cases. Right now, we are at LNJP hospital, which is one of the Delhi government hospitals. And like you know that the authorities have in fact swung into action, have asked all the Delhi government hospitals to ensure that the facilities are in place to control the dengue diseases. That is why the facilities are being done here. There is inflow of patients, but at the same time, the precautions and measures are being taken on ground. I am in fact joined by the medical director of LNJP to talk more about it. Sir, the cases we are seeing marginally have been increasing. What is really the prevention that can be taken by people at this moment?
We have the public information system here in the OPD, that how the patient can prevent from this vector-borne disease, particularly dengue and malaria. We have seen that after heavy rains and flooding, the number of cases has marginally increased. But this time we are fully prepared. We have all the SOPs, all the dengue treatment guidelines displayed at the emergency, at various departments, particularly the pediatric department and the internal medicine department, that if patient have this much platelet count, how to treat the patient, when you will give the platelet transfusion, and what are the early danger signs, where the patient should be intensively monitored. If patient have bleeding or a hypotension or dengue shock syndrome, then patient must be immediately attended, and the protocol should be followed. So this exercise we have completed, and we have also started the fever clinic. All suspected dengue cases, fever cases will be treated at the separate facility in the emergency block itself, and few beds are reserved for dengue fever patients. So this preparation we are doing every year, but this time we are more careful because this time heavy flooding and heavy rainfall is there. That's why our team of doctors are fully prepared to deal with any vector-borne cases which are coming to the Loknaik hospital.
One last question. These are the preventions that are being taken by the hospital, but for people who are at home, what are the measures that they can take to avoid this vector-borne disease?
This is a very important question, that patients should not self-medicate. They should not take medicine without the advice of doctor, because sometimes patient take antiplatelet drug like ecosporin or aspirin or the antibiotic. which have no role, antibiotic have no role in the dengue fever, number one, and certain drugs like Brufen or Ecosporin can further decrease the platelet count and it may be harmful. So always take only paracetamol, lot of fluids, and take the advice of your treating physician or a pediatric specialist. Never self-medicate, it may be harmful, and always wear full sleeve clothes and use mosquito net. It is very important that use mosquito nets.
With incessant rain in the national capital, we have seen how there has in fact been flood-like situation in the national capital in many areas. Especially when we talk about the area near Yamuna, there has in fact been waterlogging and flood-like situation. Keeping that in mind, it was very obvious that there are going to be skin rashes, skin infection. Apart from that, dengue was one of the major issues that could have been faced by the people, and that is exactly what is happening. We are seeing that in last 5 years in Delhi, the dengue cases are on the rise since 2018. This is the highest record of the dengue cases that are being reported. At the moment, till July, we are seeing that almost 300 cases have been reported, and around 56 cases have been reported in last week itself. So clearly the dengue is on the spread. We are right now at LNGP hospital and you can see the inflow of the patients who are here. But there are in fact facilities that has been made to ensure that proper precautions and measures are taken, proper treatment is given to the people who have in fact coming here. While the dengue is on the rise, the Delhi authorities have also in fact swung into action. They are in fact creating awareness programs in schools and hospitals, have asked all the Delhi government hospitals to ensure that the hospital is ready with the bed facility, with all kind of facility to deal with the situation if the cases rise from here. The reason why all these precautions at the moment is being taken is because the flood-like situation that Delhi saw, and there could in fact be a major scenario where the dengue cases could in fact rise from here on.